Well, I just really do appreciate this opportunity because I always learn something new, and I really do appreciate the collaborative in sharing information across states. And, like Jill was saying, we do have a list of topics and really just want to learn. We don't have to go in the order as they're listed, and hopefully all of you have the agenda. I could certainly put it in chat, but I think Jill did, if we can still see that. Is there a particular topic of the three listed that someone would suggest we start with? We've got stakeholder involvement, marketing and outreach, offering information and assistance. And I apologize, we should probably just quickly go around since we're a small group, just to remind each other maybe where you're out of. And I'm happy to start. So Aita Stevens out of Oklahoma. We actually contract with the Aging Services, and we have a great partnership with our state partner. For years, we've worked very close together. And I'm also a family caregiver, blessed with 4, and our oldest has a rare chromosome anomaly. She has significant disabilities. And so I'm also a parent, as well as our program, Sooner Success. We are statewide, and we help family caregivers across the state with respite vouchers and other resources that they need. And so again, I'm always just so grateful to meet all of you and learn from you because our family caregivers benefit from that. So who wants to go next?
I will, just to go because I'm unmuted. I'm Lynn Fines with the Idaho Commission on Aging, and I love Oklahoma's story. And I don't know how to say your first name.
Aita.
Aita. I love listening to your story. Yeah, gosh, I think I would really like to talk about stakeholder involvement, because it's really hard, since I'm working in the aging community, to reach that whole community of lifespan. That's what we struggle with here. So that's kind of, my agenda for today.
Well, I love that. And we will start with that one as we quickly go around to the others. And let's start with stakeholder involvement after everyone has a chance to introduce themselves. Great. Thank you, Lynn. Who wants to go next?
Good afternoon. I'm Hannah Quering. I am the program coordinator for the Lifespan Respite Services program in the state of Nebraska under the Department of Health and Human Services. I'm kind of here representing a current contractor that we have. I assist with contract management, but they are doing a startup of a program to provide respite at least quarterly for individuals over the age of 50 that suffer from dementia or Alzheimer's. So I'm kind of here just taking notes because unfortunately she wasn't able to make it. But it's nice to meet you all.
Glad you're here. Thank you.
I can go next. I am Yasmin Orozco, and I'm with the Aging and Disability Services Division, Nevada Lifespan Respite Program. I am currently the project coordinator, and we also help out with a self-directed voucher, which is our emergency respite funding.
Great, thank you. Amber, you mind going?
Sure. Hi, I'm Amber Goodrich. I'm from the New York State Office for the Aging. We are, as Dina Press, my colleague, had shared earlier on the call, we are currently in the process of expanding our caregiver-directed program under the National Family Caregiver Support Program, and that will include vouchers. That hasn't been an option so far, so we're working on that, and that should hopefully be rolling out within the next few months. So I'm also kind of on here just more for the learning side of things. Won't have probably too much to share because we haven't implemented yet. So happy to be here. Thank you.
Great, thank you. Is it Anna Marie?
Hi there. Good morning from Nevada, the Pacific side. We're still waking up over here. I am Anne Marie Kolb. I am the Caregiver Support Coordinator for Aging and Disability Services. I also oversee our 3 lifespan respite grants. We have one main lifespan respite grant that we've had for many years that we've been working on, and that provides our emergency respite voucher assistance. We also have a newer grant, about a year old, that we're working on to try and provide an internship opportunity to increase workforce. And then our newest grant that we're trying to get started is for dual diagnosis for children. So we have a lot of different projects that we're working on, a lot of things we're trying to get off the ground. And I'm also pretty new to this position, so I'm trying to learn as much as I can from all of you.
Great, thank you. Tracy?
Everybody, I'm sorry I got kicked out and put in a different group, and so thank you for allowing me in. I'm Tracy Sinowitz with Alabama Lifespan Respite, and we have been ACL Federal Lifespan Grant recipients since 2009. We currently have 2 running concurrently. We do offer universal and emergency respite, and we are one of our newer projects is offering 8 hours of basic respite provider training online for anyone who would like to take it.
Great, so glad you're here, Tracy. And it was recommended by Lynn, we start with stakeholder involvement. And really, I think that's each one of these topics is always so helpful. And really our day-to-day, we're likely really addressing or trying to address these topics. So stakeholder involvement, and hopefully you all have the link to look at the handbook that was provided. But really, this is just a time again to learn from each other. I would love to just open it up and see if someone wants to share a success or even challenges around stakeholder involvement. And I certainly don't mind starting, but I don't have to. If someone wants to start us off, that would be great. Okay, while you're thinking about that, and this again it's one of those key elements, I would say, and it really takes intentionality. I know partnerships are great, but they're better when you can build upon them and just have that ongoing relationship where you're strengthening communication and building those relationships. And here in Oklahoma, I would say what really does help us is our Oklahoma Caregiver Coalition, is what we call it. It's a quarterly, now virtual, all virtual. It was hybrid pre-pandemic, but we had a meeting actually this morning, and it's really one of those meetings that, like this, we can share information, but we also have key, programs or presenters. But I would say that's like the overarching. But what is another pillar of that is we have a respite subcommittee. And that respite subcommittee is those coordinators or really key personnel that are involved with the varying statewide respite programs. So that is your developmental disability services, your Veterans Affairs, SSI. In each state, you all have different respite voucher programs. And so here in Oklahoma, I feel like those teams, when they get calls, they're they're really intentional about trying to help that caregiver. It may not be their program, because you all know, like with Lifespan, it fills the gap. And so our team really has to be knowledgeable and is knowledgeable of the other statewide programs, so that as we get calls, we want to match them, connect them with the appropriate program. That subcommittee, I believe, has really helped just foster those contacts, those relationships, and those key personnel for each of those respite programs are sometimes in daily contact, because we don't want to not help a family caregiver. So we want to have the information on who, what eligibility, they meet, and we want to connect them. We've actually been able to build upon how that looks, because we've got an online referral link, which is HIPAA compliant. It's called RedCap. I don't know if you all have something similar, but it's an online link that these programs could actually refer a family caregiver over, so that we can connect with them to help them with respite. And so, of course, they can use email. They're on the phone with each other. Sometimes unique situations come up, and we just really do have that open communication to help. And of course, the coalition comes into play, because not only do those family caregivers need respite, they need other resources. And that's where the other community partners really come in and are great at helping us as we're trying to help families when those unique needs come up. We really do have some great partnerships to be able to connect them with. And honestly, we say this over and over, we couldn't do what we do without our partnerships, because one, we don't have like this huge marketing budget where we're able to just like spend a ton of money on, getting the information to caregivers. I know it kind of relates to the other topic, outreach, that we're going to talk about, but those key stakeholder partners are really great also about helping us get the information to family caregivers that we otherwise maybe would not be able to connect with. So I really can't emphasize enough the importance of just establishing those relationships and really building upon them, because it's one thing to maybe just know who it is, but be up to date even before a website is updated, to have knowledge of maybe not only their respite program, but perhaps other services that they're able to offer. So stakeholder involvement, again, I think it takes time. It takes just really an openness to, yes, like strengthen that partnership, but also have that open door to where new partners, when you might make those new connections, because you just never know how or when you're going to really need to collaborate. And just having those stakeholders involved, I think, just puts you in a better position, and help your efforts in trying to help family caregivers with respite. So we also have community coalitions. So those are more like in Oklahoma, we have 77 counties, and those community coalitions are meeting monthly. And they, again, are that grassroots involvement to where those partners are working together on a more regular basis. And that's building those community relationships, because as we all know, there's statewide programs, of course, but there's also specific community resources and programs. So the coalitions really are that driving force too, and staying up to date with that. And then again, as we're in contact with families, to be able to relay that information. So stakeholder involvement, again, can't speak enough about the importance, but I do know it really does take intentionality and I would say regularly meeting and communicating. Is there someone else that wants to share about your success or challenges around stakeholder involvement?
We too, in Alabama, we have a coalition and depend, a great deal on them as stakeholders. And, like you said, just to reiterate, that is such a wonderful resource for us to be able to intimately know what their agencies do, as well as for them to be able to go and relay our message as well. So, it's a great resource, great partnerships through that. And, but through that coalition, we also, something that has been a great benefit to us, we're able to interact more one-on-one with our legislators. And when we can go with the head of Medicaid to a legislator and say, this is what we're doing for caregivers in our state and how it affects your constituents. And, or if we can go with, Director of Children's Services or mental health or whomever that's on our coalition and go with them to these legislators and say, this is how, the state dollars impact, caregivers statewide. That has been such a benefit to us. So, utilizing those contacts that some of these agencies have that we don't, and getting that face-to-face time with the legislators and creating stakeholders in that way, that's been really beneficial to us.
That's great. And that's just so important to, you're right, that collaboration really likely speaks volumes in terms of those conversations with your legislatures. So that is an excellent point and another benefit of stakeholder involvement. Does anyone else want to share on that topic?
Hi. In Nebraska, we have the Nebraska Caregiver Coalition that they hold monthly meetings. And then addition to that, we have advisory committee meetings that are hosted by the different service areas in the state. The specific respite coordinators assigned to those states host those meetings quarterly. Some do monthly. But that's a great collaboration of local agencies and stakeholders in those specific service areas. And then in addition to that, we also reach out through marketing efforts like publications across the state. We also have a DHHS public site that provides information specific to respite, as well as all of the materials and resources. And then we have a public respite page. Kim Falk is our employer engagement respite coordinator. She spoke at the national conference recently. She presented, and she does the employer engagement portion of it. And the employer engagement is a unique little factor that we have in the Nebraska network of, she reaches out to local employers to provide information about respite, to provide information about being a working caregiver and how they can incorporate that into their employment benefits, maybe by providing information about the respite program, as well as she goes and speaks, typically virtually because we serve so many counties, but she attends the advisory committee meetings in each service area to share that information so that potential employers that are interested in participating in the working caregiver survey can contact her or have that information. So that's kind of a unique little tidbit that we add for the Nebraska, is having that and trying to engage employers so they are more conscious of the working caregiver and the strain that that can put on their employees, as well as providing resources to them and their families.
Great. That is just so important as well. And as I'm reading through the guide, we really have already touched on some key points that the guide points out. Are there others that want to share successes or challenges around stakeholder involvement?
Yeah, in listening to everyone and how their structure is set up, it's apparent that possibly our structure is a little bit different, to where we have a lot of sub-award partners and we have a lot of communication with them through regional planning groups and various coalitions. I think our struggle is more so, how do we reach those stakeholders outside of those organizations who don't necessarily receive funding from us, and how are we engaging them regularly? And I think that's something that we'll need to look at.
Yes, I know part of this is also involves evaluation surveys, even focus groups, telephone responses. So I know we have certainly continued to try to have multi-faceted approach to getting that feedback and making those connections. And so I think you're right on in terms of being aware and mindful that although you have those stakeholders involved that you're contracting with, what are some ways to really reach the broader community stakeholders to really help you all? And I think and sometimes I know people do get survey fatigue, but those are just great tools to really assess, on is there an interest? Is there a partner that perhaps we should be coordinating with? And that's just, one way that we certainly have used like a survey or a formal mechanism to get that feedback. And of course, anytime we're doing a community event or statewide event, we're also always having evaluations and just a way to learn and improve on how we can reach others, and even those that attend or participate, just hearing in their own words how what future activities they want to participate in, or what would they like to learn about more. So perhaps it's partnering with someone on your team that could just really try to look at an assessment. I know we've done that. We surveyed family caregivers, and we've surveyed providers. And what was interesting though, and what our big takeaway too, and that's actually helped us develop those subcommittees that I mentioned on the coalition. But respite, of course, was the top need that was the big takeaway for both, for family caregivers and providers. So, but does anyone else want to, because I'm trying to be mindful too of time, we do have time to talk about another topic. Is there anything that anyone else would like to share around the stakeholder involvement? And if not, do you have a suggestion on the next topic that you would like us to discuss? It's marketing and outreach, or offering information and assistance. Amber, I'm sorry, are you telling us something? Because I'm not.
Sorry, I was double muted on my phone and on the computer. Sorry about that. Yeah, I just wanted to share really quick before we go into another topic. We, in preparing to expand our caregiver-directed respite model under National Family Caregiver Support Program, we held a work group with all our, well, not all, but a certain number of area agencies on aging in New York, and then some of our state respite organizations. And we kind of focused on a different topic. We held those monthly. A lot of the same topics we actually discussed in this collaborative. So that was helpful just to kind of get all their thoughts on what they think would work and what wouldn't work when we kind of go to build our model. And ultimately it's going to be, I mean, we're at the state level, we're leaving a lot of decision making up to them at the county level. But we also, another thing that came out of that was we held a caregiver focus group and asked a lot of those kind of same questions and decisions that we kind of discussed in this collaborative with the caregivers. So that was just really eye-opening to see their thoughts on things like training requirements and different things like that. So that was really helpful.
You're right. It can be very eye-opening, you know, just hearing from others on maybe some areas that you otherwise didn't think about or, you know, hadn't been addressing. And so I do appreciate you sharing that, Amber, because that's been beneficial for us as well. Anytime we do a formal survey or specific to trying to hear family caregiver voice or providers that serve them, it's, you know, we're always, we learn so much in doing that. And I think those are great points. Anything else before we move on to the next topic? And is there out of the two, a topic you want to discuss first?
I think marketing and, oh, sorry, I apologize.
No, I was going to say the same thing. The marketing.
Yeah. I think marketing and outreach is a topic that is always needing to be approached, addressed. So I think that's a good one.
Yes, I totally agree. Does anyone want to share your successes and challenges around marketing and outreach first?
I think the biggest thing that we are running into in Nebraska is outreach to the elderly population, making sure that we are making contact with them. Primarily like the rural areas, the agricultural communities, which are big in the northern and western part of the state. But that's where we're seeing, I don't want to say fewer numbers because we have great numbers of clients, but it's more specific to the under 18, under 19 age. And I think it's also letting them know that the resource is available, but that as well as the mentality of they don't want to ask for help, but just seeing it as like, you know, maybe already you have a neighbor that is coming over and assisting while you go and run errands or something, but that you can still, you know, possibly be eligible for this program. So approaching that in a way that that they're receptive to, but also just that outreach in general, because a lot of things are now technology wise, you know, on social media platforms, or it's a link and they don't utilize that. But also, you know, like they see something in the mail and, you know, how many times do you see something and then like casting it? So just making sure that that marketing and outreach is also targeting that population, because that's an area that I think probably across the board we all see is more difficult to reach and make it known that this resource is available.
Yeah, I think that's really a common challenge too, because we certainly know one size doesn't fit all. And we have to really look at innovative ways to reach in the rural communities too. I think you raised a couple of good points. I know in this collaborative some time ago, one of the state partners mentioned, which I thought was a great idea and maybe relates to this as well. They partnered with the local pharmacy and they basically printed their program information in partnership with the pharmacy. And that was that paper copy that was disseminated. Now, of course, I know it gets costly, so partnering with the pharmacy, I think was really helpful for them, where I don't believe the program had to pay for the printing. And of course, I know another community project, they partnered with the utility company. You know, sometimes utility companies will allow you to put something, but I do believe they had to provide the printing, because we all know too, with the cost and supply right now, I don't know if you all are running into that. We've had to just really get even more creative, because we may want to give them multiple pages, but because of the supply shortage, we have had to reduce even what that handout looks like, so that we can produce more of them and have something tangible. Because as convenient as electronic is, you're right, even when they have knowledge, what we run into is the consistency of having access to internet and phone service. So it's certainly a challenge, and I don't know, I'd love this discussion in terms of thinking innovatively and some strategies that helped any one of you, as Hannah has talked about reaching those in rural, I apologize. Is there something that has you all have thought of creatively and maybe is not as expensive when it comes to targeting a population that may need something more tangible, or even have any of you done like phone calls or any, you know, any other ways to reach the older population, or even those that may not have internet access? Any strategies that have helped?
I can speak to that a little bit more, since I've been trying to do more outreach efforts with our lifespan respite emergency funds. And so what I have done, since I had to start, you know, practically fresh, and it was during the pandemic that we started our emergency fund. So what I did is I just started Googling senior centers, community centers, youth clubs, the schools, churches. And so by coming up with all of these different local organizations that I know people are passing through on a daily basis, or at least on a weekly basis, and then I figured out, oh, if I send out these flyers and information on our respite funding, then we would be able to get at least somewhat of questions and phone calls from like the pharmacies or any of the churches. Another one was the case managers with the hospitals and local hospices. Also, I provided them with a flyer and information. And one of my little successes that I was really proud of is being able to reach out to our tribal communities and the reservations just by sending them something in the mail. It had somewhat of a ripple effect, because then they could talk about it amongst their elders, and I was able to get more phone calls and people wanting to know, what is respite? Oh, I have a neighbor that comes in and helps me out a couple times. Is that considered respite? And I'm like, yes, that's exactly what it is. So yeah, I think we underestimate the mail a lot, and I haven't been able to get out in the community as much, but that's our plan moving forward. And yeah, I think for those communities that don't have, let's say, like Wi-Fi or smartphone capabilities, yeah, using the mail has been successful for us.
This is Lynn. From Idaho. I have a challenge and a barrier, and I work with the our 6 area agencies on aging. So I represent the aging community, And we go to sometimes to congregate meals, or we'll put notices in food boxes and kind of spread, the word that way on services that we offer. But a challenge that I've been told through my AAAs is, since we're focused on older Americans, is trying to reach that, and we're working with Lifespan, is trying to reach that lifespan population. Some of them could be grandparents raising grandkids, younger, or relatives as parents. And really that younger group that, is younger than the older Americans, and that aren't already being served. So that's one of the biggest challenges I think that we have is, well, who are they and where are they and how do we reach them?
Yes, I know for our program, we've had great success in partnering with schools. Schools are, again, sometimes it helps if there's a connection, because, it's certainly a process in building those relationships, and they obviously have to be, careful. And years ago, when I worked more involved with public health, I've learned from the school we partnered with that they're always contacted. So I think it helps when maybe they're involved on a coalition, inviting them to partner on an existing effort. And of course, just dropping some flyers off, trying to get a meeting with maybe the director of special education services, or just offering to provide a presentation. I know that's what we really do as a team, in trying to get the information to the school personnel, because we know families are asking them, and then they feel maybe it's a win-win for them, because they don't have to maybe keep up with everything in terms of those resources. They do, don't get me wrong. I mean, I think some of them even are tasked with taking time to make sure they have the information. But if they see the mutual benefit in that you're actually able to help them with something that is taken off their plate, so to speak, it really is a great partnership in terms of helping the families, because many of them know firsthand those family caregivers that would really need a break. They know firsthand. And so just connecting to maybe who are those community partners that are in contact with that younger demographic that you're trying to reach, including grandparents, because here in Oklahoma, we're certainly seeing a growing number of grandparents raising grandchildren. And again, those teachers maybe be well aware of who are those grandparents that would really benefit from additional support. But I, of course, want to hear from others too, like, has there been that community partner or relationship that you can think of that has helped you reach maybe a younger demographic?
Like, one thing we've done in Alabama, we've been able to partner with through the Alabama Department of Rehab Services, their Children's Rehab Services Division, and in their clinics that they have them, regionally all throughout the state. So when families come in for services, for rehab services, in their lobbies, they have televisions and have promos running. It's all in-house. It's not TV. It's in-house promos. So they've allowed us to do a PSA about respite and run it there. So that was no cost to us. They even offered to, help produce that. So that was a good low cost or no cost solution to get in front of a younger audience. And also with, so it's coming up pretty soon, but we have a statewide social work conference in the state. And in addition to exhibiting, they allow us to present there. So we're able to present like a respite 101 and tell them, what respite is, the importance of respite, and how to help the families they work with access it. And so from there, we ask them, to come by our exhibitor booth and give us their email address. And then we push out our constant contact email newsletter to them to just kind of keep it on their mind. And so those are social workers from hospitals and from Child Protective Services and from foster agencies. And so a lot of times they'll take materials away with them from those conferences, but a lot of times they just get with us afterwards and say, hey, can you mail us something? Can you, whatever, send us more information. So those have been good avenues for us to reach a younger population. And then here in Alabama, we also have a program called Kids and Kin, and it's kinship, caregiving, and grandparents, aunts, uncles who may be taking care of a child with special needs in their, in their family realm. And we're able to go and present. There's one Kids and Kin group in each of the 67 counties. So we're able to go and do presentations with them, every year. So we may not do every county every year, but we hit about half of them every year and then swap. So that's been another good way for us to get into in front of a younger population.
Tracy, you reminded me, and again, this is maybe something that wherever you all are, it's partnering with maybe that local hospital or health provider, because you're right. Many times they have that digital sign in the clinic or in the hospital, and they would not charge you, at least in our experience, we haven't had to pay. But you're exactly right, because that is an inexpensive way to just hopefully get the information to those families. So thank you for that, because that is a very effective, no cost way to get the information out there. You also, one thing that we work on regularly are community events. And again, like we just had a big Family Fall Festival. It's really just exactly what it is. We're trying to have some fun activities. So you could actually partner with some of your faith-based partners, or even a school, or who are those community partners? Because let me tell you, you need partners to put on something like that, because if you're trying to reach a number of family participants, you really do need multiple partners to help you. But we have found real success when we do these community events that they're drawn to. Then you can obviously take the opportunity to share respite information and other resources. Those have been very successful. And of course, we love to have fun activities so that you can actually have, even, it might be brief, but you have that one-on-one conversation with the family caregiver while their child is participating in a fun activity. So those are great examples. And I know we have about 10 more minutes. Does anyone else want to share? I know social media, of course, when it comes to marketing and outreach, has been widely popular. We know that not everyone is on social media, but I am always just so pleasantly surprised at that. Again, there's multiple platforms. Is there anything that someone wants to share that has helped them in terms of social media or another mechanism to electronic? Any strategies around that? I know virtual meetups have been good. There's nothing like in person because, it's so great to actually be in person, but virtual meetups have certainly helped us. I think we're running out of time already. I'm sorry.